This is Radio Health Journal. I'm Reed Pence. This week, people who are addicted to clean eating.
You want to say to the person, or sometimes there's an instinct to say, well, why can't you just eat? But for that person, the behavior is a coping mechanism. It's a way of dealing with deeper issues.
Orthorexia, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
As I learned poker, as I became better, as I learned the game on a deeper level, I found myself making better decisions and growing as a person outside of poker.
The parallels of life and poker. Then,
it really truly was exactly like what you would expect.
Is lab-grown meat the future? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
About 1 in every 10 Americans suffers in some way from disordered eating, and most of us are familiar with disorders such as anorexia, bulimia, and binge eating. But there's one other eating problem that's growing rapidly, a category new enough that it's not even recognized as an official diagnosis yet. It's called orthorexia.
When we talk about orthorexia, what we're talking about is an obsession with health and with issues like clean eating and eliminating entire food groups, and this idea of eating pure or to optimize our health. And that can often become very, very restrictive and dangerous.
That's Claire Misko, Chief Executive Officer of the National Eating Disorders Association.
And this is something that we're hearing more and more about from clinicians who specialize in eating disorders, that they are talking about how patients are coming in really obsessed with this idea of health. And now we have this broader category of wellness, and that adherence to this idea of health and wellness is actually masking much deeper issues and pathological attitudes and behaviors surrounding food, weight, and sometimes that can also relate to body image.
It is commonly seen a colloquial term for healthy eating to the extreme. And so individuals start out trying to improve their health, and sometimes an addictive process takes place where instead of them controlling their food and exercise, they feel controlled by the food and exercise.
Dr. Jennifer Carter is Clinical Associate Professor of Psychiatry and Behavioral Health at the Ohio State University Wexner Medical Center. She says one telling factor for orthorexia is whether food and exercise make a person distressed. If they're not worked up about it, no problem.
But if they're distressed because perhaps they're missing social time, they don't have good energy because they're not fueling their body accurately, they may have sleep difficulties, irritability if they miss workouts, just inflexibility at restaurants, for example, that distress factor is part of defining a disorder.
When they're looking at this healthy eating, it becomes a place where they're so either fearful or holding on to this idea that if I eat, let's say I have a piece of white bread, then I am, not honoring my health, and maybe even something terrible is going to happen around that. So it becomes this place where that food becomes so forbidden and so feared and so bad that some of them can't even buy white bread, right? Or they can't for sure eat that white bread. So it becomes this very fearful, obsessive type rigid thinking.
That's Dawn White, a registered licensed dietitian at Timberline Knolls Residential Treatment Center in Lamont, Illinois. She says many people with orthorexia are dangerously thin, similar to people with anorexia. However, unlike most eating disorders, which disproportionately affect women, orthorexia seems to show up just about as often in men. Often, the time they take researching and preparing just the right food disrupts normal life. It's a clue for when a dangerous line has been crossed.
Some statistics have shown, like, if you're spending 3 or 4 hours a day or more really focused on food, then that's probably interfering with some of the other important things in your life, like relationships and the activities that you enjoy to do and things like that. So time is a big one. The other one is, how is it affecting your relationships? Is your rigidity around food and your food rules keeping you from going out with friends and having dinner with them, right? Or going to a house or having them come over to your house? How is that affecting your relationships?
But where does orthorexia come from? Carter says there's no single cause for any eating disorder, but experts know genetics play a role.
We're understanding more that eating disorders are highly heritable, almost as heritable as height, for example, and that some other risk factors include sociocultural pressures to be very thin and or very muscular, and some evidence that starting dieting at an age before the age of 14, dieting or extreme exercise can put someone at risk.
Misko says the cultural messages we all get say that a healthy diet and exercise are good things, so eating only healthy things to the exclusion of everything else and exercising till you drop must be really good.
As a culture, we are hearing more and more confusing and mixed messages about what it means to be healthy. So I think this larger cultural obsession with health is a major contributor to this behavior.
White says the death of a family member who didn't eat a healthy diet, or sometimes just a few words from a friend, can push a vulnerable person into orthorexia. Lately, nearly 4 months of at least partial isolation have also taken a toll. Carter says for most people in recovery from orthorexia, it's been a rough time.
Isolation causes decreased support, and individuals recovering from eating disorder need a lot of support. They have this very critical voice in their head that is dictating their behavior, and it's helpful if there's a loving, supportive person with them to help them follow the meal plan, to help them stay in their exercise plan and not go above and beyond it. So if they don't have anyone to eat with or have accountability to, they might increase behaviors of food restriction or binge eating or purging. And I think also there's a lack of structure for many people in this pandemic. If they perhaps are working from home or furloughed, they're having breaks from school or trying to do online classes. Structure is a big part of treatment to help an individual develop a routine that includes following their meal plan. And so with no structure and very little support in the pandemic, many people are struggling.
However, Carter says some people with eating disorders are thriving in the pandemic, those who've had opportunities to slow down their schedule and improve their eating behavior. But that all could change soon. Since adolescence and early adulthood are the prime age for eating disorders, Carter will be closely watching how students react when they start classes again late this summer and get back into something that's closer to their normal routine. Some will be relieved. Some won't.
I talk to a lot of, for example, college student athletes or very busy people who are overscheduled, and I think that is an attempt perhaps to reduce anxiety, like workaholism or keeping oneself busy. But I hope that as we resume our normal lives, that we're not kind of resuming that frantic pace that can fuel anxiety and eating problems. So it's an opportunity to create a more doable schedule with more self-care and more rest. Anything's possible in terms of how someone deals with all these fluctuations in their lives.
However, when someone responds to those fluctuations with an eating disorder, Misko says it's likely there are other mental health issues going on as well, such as depression, anxiety, and past trauma.
Eating disorders do not exist in a vacuum. There is a high rate of co-occurring conditions, so counseling is really key. Eating disorders are mental health issues. Oftentimes, friends and family members really struggle with this because the eating behavior or the obsession with exercise becomes the focus. So you want to say to the person, or sometimes there's, an instinct to say, well, why can't you just eat? Or you shouldn't exercise past the point of exhaustion or injury. But for that person, the behavior is a coping mechanism. It's a way of dealing with deeper issues, and those are the issues that need to be addressed.
There's some evidence that individuals susceptible to eating disorders may be highly emotionally sensitive, have a depth of emotional sensitivity, have a gift of emotional sensitivity. So in counseling, we often try to help individuals develop more effective coping skills for dealing with emotions. And there are different treatment approaches, whether that be cognitive behavioral therapy, dialectical behavioral therapy, interpersonal therapy, to try to teach skills. For example, if I'm really feeling upset by something that my friend said, and I don't have the skills to talk to my friend about that and to work through that conflict, I might turn to food, either not eat and feel more in control, or perhaps binge eat to sort of de-stress in the moment. And teaching assertive communication skills is an example of a skill set we teach in counseling.
Unfortunately, many people are unaware just how complex eating disorders can be, both those suffering from the disorder and their loved ones. So Misko says they may not seek professional treatment.
There's often a tendency for people to think that they can solve this on their own, but it really does require professional help. So the first step is getting connected to a clinician who specializes in eating disorders. Many people also benefit from a support group or group therapy. And with orthorexia, we often find that because the nutrition aspect of this is such an obsession, that working with a nutritionist or dietitian who specializes in disordered eating is really key.
I'm a dietitian, so I'm working from that dietitian perspective of education around nutrition and food beliefs and what is true and what is maybe some false science that we're getting, and doing some of that education. But that alone typically is not helpful in the treatment of orthorexia, because so many things, like the connections we were talking about, it becomes this ideology for them, this belief system that's so much deeper than just knowledge base. So I love incorporating a therapist and, if possible, a medical doctor and a psychiatrist, and getting that team together to be able to see all of those different things that are contributing to the disorder.
Therapists have become adept at using video sessions to counsel patients. So while they haven't been able to eat together as therapists like to as part of treatment, White says treatment still works.
With all eating disorders, though, there's always hope, right? There's hope. We see recovery. We see people being able to move from this fear of food into freedom of food. And sometimes it can happen a little bit quicker, but a lot of times it's a process over time of moving along this continuum of healing, right? This continuum where, they can start doing some exposure around these foods that are very scary, and processing through their feelings around that and being able to come to a place where they can accept those.
The National Eating Disorders Association hotline is available 24/7 at 1-800-931-2237. You can find more information about the hotline and about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
Staying healthy is key to enjoying a long and active life. Of chief importance, preserving a healthy brain. The brain is one of the most complex organs in the human body, and many influences contribute to its function, according to registered dietitian Courtney Romano, health advisor for the California Table Grape Commission.
While multiple factors contribute to brain health, experts believe the foods we eat play a powerful role. Heart-healthy foods from fish to olive oil to vegetables and fruits, including grapes, may contribute to brain health. A preliminary study found that consuming grapes every day helped preserve metabolic activity in regions of the brain associated with early-stage Alzheimer's disease, where metabolic decline takes hold. More research is underway to help understand the potential links between grapes and brain health.
Grapes contain over 1,600 natural plant compounds, including beneficial antioxidants and other polyphenols, which contribute to heart health and may play a role in healthy aging. Visit grapesfromcalifornia.com for more information.
A new survey from the National Blood Clot Alliance shows more than 70% of U.S. adults on blood thinners are more cautious about routine activities, and 42% say the risk of major bleeding has discouraged them from trying new ones. The findings also show more than half of those taking blood thinners fear a life-threatening bleed, and nearly 3/4 of that group say it's impacted their quality of life. That's unfortunate, says Michael B. Strife, MD, FACP, Johns Hopkins Medical Institutions.
Blood thinners save lives, but many people taking them are avoiding activities they love, like gardening or exercising, because they're afraid of experiencing serious or dangerous bleeding. That's why talking to your doctor is important to understand how to reduce the risk and learn how bleeding, if it does occur, can be treated.
The good news is that 95% of people taking blood thinners have talked with their doctor about such risks. Visit stoptheclot.org/guide for more.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It's been clear that the numbers of people with osteoporosis has been increasing, largely because more and more of the U.S. population, if we want to talk just about the U.S., is aging.
Reasons beyond the obvious why osteoporosis is increasing.
Then doctor burnout during the pandemic.
When I go into a room to see a patient, I don't want to stay there any longer than I need to, because the longer I'm there, the more likely I am to get infected.
All that and more on Radio Health Journal.